Well, you know, it's never too late and you're never too old to have a beautiful, perfect smile. And this morning, we're talking to Dr. Paul Coleman about that very subject, and you brought a guest with you. Good morning.
Yes, I did. I'd like to introduce Jo.
Hi, Jo.
She's one of our proud guests who we've recently finished up with.
And she has a beautiful smile herself.
Indeed.
Now, what exactly did you do for Jo, and how did she come to see you? Because I know she had some problems and she didn't realize them.
Things were a little crooked, and she had a daughter who said, "Mom, you really need to deal with those fangs." And so she actually
Just
came
like that,
in.
huh, Jo?
Yeah, she's a little blunt, the daughter, yes. And so she came in, and we did a cosmetic consult, and I always ask people, you know, could I do a comprehensive exam to make sure that there's no other underlying problems? And lo and behold, we found a fractured tooth that was abscessed, and as it turns out, Jo had been suffering for a number of months with a pneumonia that they couldn't fix for her because she had this ongoing infection. So we did that first. We took the tooth out, did a little bone grafting, and then we did some cosmetics up front for her, and the pneumonia went away, and she's smiling.
And we talked about that with Dr. Coleman before, about taking care of the dental problems and letting the body take care of the other things it needs to, not concentrating so much on the mouth, right?
Absolutely.
All right, let's look at what Jo's mouth used to look like, and then you can see the difference. Wow. So there was a lot going on there, just from over the years of wear and tear?
The way her bite is structured, it moved her teeth around. They get progressively more crowded. So we first zoomed white in her teeth and then shaped down the lower ones without anesthetic, kind of leveled those out. And then we did veneers on the top front 8 and gave her the smile that she has today.
Oh, man. So, I mean, it's a dramatic difference.
Absolutely.
Jo, what did you think when you saw that?
Unbelievable. All my life, I've had the 2 fangs, plus these cross.
Did you realize that something could be done?
No, I didn't even think about it. I mean, as a kid growing up, you know, that's what you got. So you deal with it. And I didn't really until Paul says, I can take care of these down here, and we can do something up there. And I had a front tooth that was also cracked.
So have you gotten compliments on your brand new smile?
Yes.
So it definitely, I mean, it doesn't matter what, because I know I've actually heard people that are a little older say, oh, you know, I've been dealing with this my whole life. What's another few years? What's the problem?
I've been hearing this for years. Or I'm married, so it doesn't make any difference anymore.
Exactly.
That's the other one that I love. But with the age group that we have in this country now taking better care of themselves, a person in their 60s very well might be able to amortize this investment over another 30 years.
Absolutely,
So
absolutely.
There's no reason that you can't treat yourself to a good, healthy smile.
Exactly, and healthy is the word there, because as you know, she had some health problems that she couldn't get rid of until she figured out she had an infection in her mouth. All right, Dr. Paul Coleman, you can catch him by going to fox6.com. If you have any questions, you can email him or you can call him at 858-748-4802. And if you do go to fox6.com, you click on Dental Health with Dr. C. Thanks so much for coming in this morning.
Thank you.
And thanks, Jo. Appreciate it.
Thanks.